According to the CDC, 4 out of every 10 unintended pregnancies in the United States of America will end in abortion. During this speech, I will inform you about the methods, statistics, and views on abortion. I am interested in this topic because while my mother was pregnant with me, her doctors advised her to have an abortion due to the fact that I have a chromosomal defect. To become more educated on this topic, we will cover which abortions are completed during the first, second, and third trimesters of pregnancy, the statistics of abortion, and the controversial views revolving around it. The CDC defines abortion as the termination of a pregnancy by the removal or expulsion of a fetus or embryo prior to viability. Let's start exploring this topic by discussing the methods of abortion. There are several different ways that abortions are carried out. According to the Choices Pregnancy Care Center, 88 to 92% of all abortions happen in the first trimester. The first trimester is the time frame between the time of conception up until the 12th week of pregnancy. If we take a look at this picture of fetal development, we can see that during this stage of the pregnancy, many important things are occurring in the womb. Throughout the first few days, fertilization occurs. Over the next few days, the child's heart begins to beat, organs are in place, and bones begin to form. By the 8th week of pregnancy, the baby can hear and has teeth and fingernails. Towards the end of the first trimester, the baby has all of the parts necessary to experience pain, including nerves, the spinal cord, and thalamus. The American Pregnancy Association was a very reliable source when it came to which abortions were performed at each stage of pregnancy. The types of abortion that are performed in the first trimester of pregnancy are the abortion pill, manual vacuum aspiration or MVA, and aspiration. The abortion pill is a combination of two medicines, mifepristol and misoprostol. It is used up to the first 7 to 9 weeks of pregnancy. During an abortion that is completed by this method, the woman's care provider will give the abortion pill to her at the clinic, along with some antibiotics in order to prevent infection during this procedure. According to the Planned Parenthood website, the abortion pill works by blocking the hormone progesterone. Without this hormone, a breakdown of the uterine lining occurs, which does not allow the pregnancy to continue. Up to 3 days after the woman takes the first pill, her and her physician choose a time and place for the second medication, the misoprostol pill. This medication will cause bleeding and cramping. This usually only lasts for a few hours. The woman may see large blood clots and or tissue at the time of the abortion. Within 2 weeks, a follow-up visit to the doctor is needed in order to make sure that the abortion was successful. It is effective 97 out of the 100 times that it is used. Manual vacuum aspiration, or MVA, is a procedure that is carried out as early as 3 weeks and up to 12 weeks of gestation and only takes about 5 to 15 minutes. This procedure is done in a few simple steps. First, the woman is positioned on an exam table as if she was at a gynecologist checkup, and a speculum is inserted into her vagina. The vagina and cervix are cleaned with an antiseptic solution and then numbed. According to WebMD.com, a small instrument is then inserted into the cervix to dilate it if needed, so that a thin tube can then be inserted. A handheld syringe is attached and is used to suction the tissue out. Most women experience cramping until the syringe is removed. After the MVA is completed, antibiotics and pain relievers are prescribed. Like the abortion pill, it only fails 3 out of the 100 times that it is used. Aspiration is used to terminate a pregnancy up to the 16th week of gestation. It can also be referred to as the DNC, which stands for dilation and curettage, suction curettage, or a vacuum aspiration. According to the American Pregnancy Association, it is performed in the same way that an MVA is, except a machine is used rather than a syringe. If we refer once again to the visual aid of fetal development, we can see that during the second trimester, from week 13 to week 27, the baby is actually starting to look like a human being. The baby can taste, dream, and even recognize its own mother's voice. Starting on the 20th week, partial abortions are performed. At the end of the second semester, the baby is now 12 inches or more and weighs up to 1.5 pounds. Dilation and curettage, or DNC, dilation and evacuation, or DNE, and induction abortions are performed during this time. We have already discussed the process of the DNC procedure, so we will now move on to the dilation and evacuation. According to the American Pregnancy Association, during a DNE, the same steps are followed as in the DNC. The only difference between the two is the fact that a DNE can be used after 16 weeks of gestation. WebMD informed me that the dilation and evacuation procedure is more commonly used than the next form of abortion we will explore, which is the induction abortion, because it is safer, quicker, and more effective. The American Pregnancy Association stated that induction abortions are rarely performed procedures where saltwater, urea, or potassium chloride is injected into the amniotic sac. Proglostins are inserted into the vagina, and Pitocin is injected through an IV. An induction abortion does cause a woman to experience all of the pains of labor and delivery. Pain medication will be administered. The third trimester of pregnancy is from the 28th week of pregnancy until birth. Any abortion carried out during this time is considered a late-term abortion. Late-term abortions are not legal in a number of states except in certain medical situations. The time frame referred to as late term is often based on when a baby is viable, meaning able to survive out of the womb. The concept of viability is a large gray area that is rather controversial. The American Pregnancy Association informed me that most medical communities establish 24 weeks gestation as the earliest time of viability. Depending on which state a woman lives in, it may be rather difficult to find someone willing to carry out an abortion this late in the fetal development. Induction abortion and dilation and extraction are the only procedures carried out this late in a pregnancy. D&E is a procedure used after the 21st week of gestation. According to the APA, it is also referred to as a DNX and partial birth abortion. Like an induced abortion, a DNX procedure will cause the woman to experience all of the pain of labor and delivery, this time including the breaking of her water. After her cervix is dilated, her water breaks and she returns to the clinic. Whenever she arrives, the fetus is rotated and forceps are used to grasp and pull the legs, shoulders, and arms through the birth canal. A small incision is made at the base of the skull to allow a suction catheter inside. The catheter removes the cerebral material until the skull collapses. The fetus is then completely removed. Now that we have covered how abortions are completed, we can now move on to the statistics that are involved. First, I will discuss the abortion statistics by age and ethnicity following it. Statistics show that 4 out of 5 Americans engage in sexual activity prior to their 20th birthday. According to the Choices Pregnancy Care Center, of all of the teenage women that become pregnant, 35% choose to have an abortion rather than to bear the child. Of the total number of abortions completed in the United States each year, about 17% of them are from teenagers. An even larger amount of adults have abortions annually. I have put the percentages of abortions by age onto a graph to get a better understanding of this information. According to the CDC, 0.4% of abortions that occurred in 2008 were from women younger than 15. 6% were from women 15 to 17 years old, 11% were from ages 18 to 19, and the 24-year-olds had 33% of the abortions. And women from the ages of 25 to 29 years old had 24% of them. Although the experiences and lifestyles of younger and older women are drastically different from each other, most of them reported having abortions for the same 2 reasons. 1, that having a baby would drastically alter their lives, and 2, they could not financially support a child. Abortion statistics by ethnicity shows that many factors influence a woman's decision whether or not to raise her child. White Americans have abortions most frequently. I have also made a chart comparing the statistics from the Choices Pregnancy Care Center. Since the concept of abortion and the statistics are understood, the controversial views of abortion are up next for discussion. There seems to be a gray area with this also. It used to be thought that a person was either pro-life or pro-choice, with no in between. As the time and culture begin to change, people are becoming more open-minded to the thought that under some situations, abortion is understandable. They may not condone it, but they can understand why someone else would choose to do so. Having a pro-life attitude towards abortion means that you are opposed to it. Having a pro-choice attitude means that you believe that a woman does what she should with her own body. CNN conducted a study over many years on the many political controversial topics such as terrorism, and abortion was part of it. The question asked was, do you think abortion should be legal under any circumstances, legal under only certain circumstances, or illegal at all times? The results were as following. During August and September of 2006, 24% of people asked believed that abortion should be legal under any circumstances. 50% thought it should be legal under certain circumstances. 24% thought that it should be completely illegal, and 2% had no opinion on this issue. During October of 2007, 23% believed abortion should be legal under any circumstances. 54% thought that it should be legal under certain circumstances. 22% of people thought that abortion should never be legal, and 1% had no opinion. During June of 2008, 25% of people thought that it should be legal under any circumstance. 51% thought that it should be legal under certain circumstances. 22% thought that it should be illegal at all times, and 1% had no opinion. During November 2009, 26% thought that abortion should be legal at all times. 50% thought that under certain circumstances it should be acceptable, and 23% thought it should be illegal, and 1% had no opinion. During April 2010, 21% believed that abortion should be legal under any circumstance. 56% of the people asked thought that it should be legal under certain circumstances. 22% thought it should be legal, and 1% had no opinion. During September 2011, 25% believed that it should be legal all of the time. 53% of the time thought that it should be legal, and 21% of people asked thought it should never be legal, and 1% had no opinion. The facts that abortion statistics are so high in teenagers and young adults, I wonder if the controversy in America should be about teenagers having sex before they are ready rather than the issue of abortion. No matter what your personal view on abortion is, at least you know some of the major facts surrounding this issue. I hope that after listening to this speech, you would now be able to identify the methods, statistics, and views on abortion. Thank you all for listening to this information.